Hello, my name is Deirdre Bruno, and I'm an Aspen University nursing student. I will be presenting today on a substance abuse case study. So this is for Healthcare 105, Professor David Hunt. So according to authors Lily Collins and Snyder, nearly 50% of all adult patients seen in many family practice clinics have an alcohol or drug disorder. Also, 25 to 40% of those admissions to hospitals correlate with substance abuse and its sequelae. So, the case study we're evaluating today involves a 54-year-old female that's brought into the emergency department. The emergency staff say that the patient was found in a nearby park. She started screaming obscenities at a jogger who called 911 after the woman fell and scraped her arm and face. Right now, the woman is bleeding, disoriented, combative, and she's accusing the EMS team of stealing her purse. You can see her hands are shaking severely, and she's shouting at the doctors and nurses that she needs a bottle. The woman's clothing is dirty, and I can smell stale body odor and urine on her. So, based on my first impressions, I believe this patient's exhibiting signs of alcohol withdrawal. There are several factors that led me to this conclusion. First of all, I considered her physical presentation and age. She's 54 years young with poor hygiene. Her clothing's dirty, she smells of urine and stale body odor, which suggests a mental health and cognitive concern. Second, her hands are severely shaking, and she fell in the park. You can almost assume that she may be suffering from a neuromuscular issue. Third, she was found wandering and became verbally aggressive with a stranger. Also, the woman was disoriented, combative, and accused the EMTs of stealing her purse. This is classic behavior of a cognitive disorder. Last of all, the woman screaming at the nurses and the doctors that she needs a bottle. This is the last clue that she may be suffering from a substance abuse disorder. Alcohol withdrawal happens only after a sudden cessation of heavy and prolonged use of alcohol and consists with severe distinct symptoms, which include autonomic hyperactivity, hand tremors, nausea, transient hallucinations, increased psychomotor activity, agitation, generalized seizures, and paranoia. Even short-term intoxicating doses of alcohol can have lasting effects on liver function. Regular alcohol consumption in large quantities results in dose-related negative effects, such as alcoholic hepatitis or the progression to cirrhosis. Also, alcohol abuse can damage other vital organs. For instance, alcohol abuse can lead to cardiac damage, resulting in hypertension, cardiomyopathy, and stroke. Additional health concerns involve alcohol-induced gastrointestinal issues, such as GI bleeds or ulcers. And routine alcohol consumption increases risk for cancers. Last of all, long-term alcohol abuse or withdrawal can result in neurological syndromes. One disorder, Wernicke's, has been associated with a mortality rate of 20% and with a 75% of developing a permanent severe amnesiac syndrome, also known as Korsakoff's. When a chronic alcohol user stops abruptly, the result is alcohol-mediated central nervous system inhibition and excitation of the glutamate-mediated central nervous system. The central nervous system's excitation results in clinical symptoms of alcohol withdrawal in the form of autonomic overactivity such as tachycardia, tremors, neuropsychiatric complications such as delirium and seizures. Also, chronic alcohol use depletes B vitamin stores through diuresis, and it also decreases B vitamin absorption through the damage done to the gut lining. The vitamin deficiency can result in Wernicke's encephalopathy. Also, Korsakoff's psychosis, a polyneuritis, and nicotinic acid deficiency encephalopathy. Wernicke's encephalopathy and Korsakoff's amnesiac syndrome are degenerative brain diseases. Alcohol withdrawal can be life-threatening. Therefore, it's critical for hospital staff to be able to recognize the symptoms. The Clinical Institute of Withdrawal Assessment for Alcohol is a scale that's used to measure alcohol withdrawal symptoms. The scale lists 10 common symptoms of alcohol withdrawal. The higher the score, the more severe the withdrawal. Also, severe withdrawal results in delirium, tremors, systolic blood pressure higher than 200, and diastolic blood pressure measurements higher than 140. Pulse rates can be higher than 140 beats per minute. Temperature can rise above 101 degrees. Tremors, insomnia, agitation would also be present. Patients who are experiencing severe withdrawal often require monitoring in an intensive care unit for cardiac and respiratory function, fluid and retention replacement, vital signs, and for monitoring the mental status. Alcohol withdrawal is usually treated with benzodiazepines, fluid and electrolyte replacement, and also restraints may be used if the patient's confused or agitated. That's for the safety of the patient and for the staff. Alcohol toxicity is treated with supportive measures, and it strives to stabilize the patient and maintain the airway. And then moving on to our critical thinking question. Mental illness is managed by pharmacological and therapeutic methods for treatment. The treatments in the current model of conventional mental health care include psychotropic medications, psychotherapeutic techniques such as insight-oriented therapy, cognitive behavioral therapy, electroconvulsive therapy, and transcranial magnetic stimulation. Insurance companies apply strict regulations and limits on mental health care claims. According to DeGore, in February, researchers at the Congressional Budget Office reported the private insurance companies are paying 13 to 14% less for mental health care than Medicare does. The World Health Organization has recognized mental health as a global health crisis. Even with the availability of psychotropic medications, the limited effectiveness, safety issues, and high treatment cost have accumulated in a large portion of the populations with unmet needs. In an effort to improve mental health care treatment, the World Health Organization published the Mental Health Action Plan to be introduced between 2013 to 2020. It set forth 4 major objectives. The first one is to have more effective leadership and governance for mental health. The second is provision of comprehensive, integrative mental health and social care services in the community-based settings. The third is implementation of strategies for promotion and prevention. And the last is strengthened information systems, evidence, and research. This is a global crisis right now, and in the United States today, there's many mental health patients that are cycled in and out of the ED departments. They go in, they get bandaged up, taken care of, and released back onto the streets. So it's really important to have outreach in the community and a lot of supportive measures to really get in there and reach those people and possibly be able to make an impact. Also, they're working with the insurance companies to hold them more accountable so that they will provide a better foundation for covering medical and mental health care costs. Thank you so much for listening to my presentation.